My name's Lori Berard. I'm a registered nurse and a certified diabetes educator. I'm from Canada. I function there as a consultant in diabetes management and clinical trial operations. When we were talking recently about the incidence of hypoglycemia, fortunately in Canada we have some relatively new data. It was data that was gained from anonymous surveys, and actually, in fact, the data that was presented, approximately 42% of people with type 1 diabetes have daytime hypoglycemia, about 17% of people with type 2. About 13% of type 1 people have some nocturnal hypoglycemia, and about 11% of type 2. And severe hypoglycemia for both groups was around 2.5%. I have to say, I'm shocked that that's how much hypoglycemia is occurring, because my patients never talk to me about it. Specifically to individuals living with type 2 diabetes, the incidence of hypoglycemia is actually quite rare, and I think that's because we don't do a great job of getting them treated to target. So theoretically, if we actually medically manage them and properly dose their insulin, we might see a little bit more hypoglycemia. However, thinking about the data that was collected on individuals with type 2 diabetes, there's actually more hypoglycemia than I realize. Why do I think I don't know that? Is because I, like many other people, are not asking the right questions for those patients. And they may actually not understand that what they're feeling is in fact hypoglycemia because they've never been educated on the symptoms of hypoglycemia. It's been an interesting time in diabetes because we're coming out with new therapies that have reduced risk of complications in terms of hypoglycemia. So I think one of the things that we really need to do is to remind people treating diabetes that hypoglycemia is still a complication. Despite all of what we've learned about new therapies and low risks of hypoglycemia, it still happens. We should make sure that our healthcare providers are looking for it and providing proper patient education, and whenever possible, using therapies that put the patient living with diabetes at the least amount of risk of hypoglycemia possible.